Hello, everyone. So we launched the first Reinhartz Rundown with a 4-part mini-series on beta blockers in heart failure. But I thought I'd jump on and do a quick update today because I am feeling particularly inspired. In the last 1 month, I've had opportunities to attend 3 conferences. 3! The Atrium Health Community Paramedicine Conference, the EMS World Expo, and the Florida Pharmacy Association Mid-Year Clinical Conference. Talk about an interprofessional growth month, the brightest, most driven, knowledge-hungry paramedics, pharmacists, physicians, EMTs, social workers, nurses. I just love it. Now, when I go to a pharmacy conference, they're always talking about medications, but I noticed so many EMS and paramedicine presentations this year talking about the meds. It shows we are realizing just how much the medications matter, how much chronic disease management matters, and how much more I can do to support all of you out in these communities. You guys are serving as the solution to our access to care problem for patients who are critically ill, for those struggling with COVID, with mental health challenges, and with those chronic diseases that we see every day. So here's what we're working on. Number 1, a COVID19 Therapeutics training course so that pharmacists, nurses, paramedics, EMTs, and physicians have resources on monoclonal antibody administration and also the new oral agents in the pipeline. This will help us treat patients at home before they're critically ill and reduce the struggle that they have to access the care that they need. Number 2, mental health courses. We'll be reviewing some of the most common conditions we regularly see in EMS, in our pharmacies, in our ERs, and in mobile integrated health patients. You'll get disease review, you'll get additional patient education, side effect profiles, monitoring needs of these meds. If you guys have patients with depression, anxiety, bipolar, schizophrenia, or if you have patients with mental health conditions and chronic diseases on top of that, this is the course for you. Number 3, a Reinhartz Rundown drug interaction series is coming, reviewing some of the most common drug interactions you'll see in practice. Excited about that. And finally, number 4, a free resource, how first responder agencies can utilize a pharmacist on your team. As a pharmacist in EMS, I get constantly asked, wait a minute, you're a pharmacist, how does that work in EMS? So I created a list of some of the things that we do. This free resource gives you insight on how you can be utilizing a pharmacist on your team to improve outcomes, serve as a clinical education resource, and conduct research, and a whole lot more. Click the link, check your email, and get free insight on how to push things onto a pharmacist so that you can save lives on the front line and do what you do best. That's the Reinhartz Rundown.